Hello, thank you so much for joining me today for this video. I wanted to give a little more information on cannabis, specifically medical cannabis. My name is Rita, and I'm here with Seraphim Holistics, a holistic center that specializes in meditation practice and cannabis caregiver counsel. So what I'll start with today is a thank you to my sponsor and my partner for the location that I am able to meet my meditators at on Sunday, and that is Gateway Healthcare Services. They are located in Dunkirk, Maryland. They offer same-day appointments for telehealth and also in-person visits on Tuesdays in Maryland for cannabis consultation and certification. Please reach out to them. I will have that link below, Gateway Healthcare Services. They also offer wonderful products for skincare, and you are welcome to check that out as well. And then number two, I want to give you an announcement. There will be an impairment education, drugs and alcohol, and cannabis use workshop. The Chesapeake Region Safety Council is the organization, the nonprofit that is putting this on. I am directly connected with the organizer, and this is directed to supervisors, workplace, and highway safety professionals. And yes, so I will have that link below as well for you to check that out if you are interested in that. So let's get into just a few details about cannabis today. We're going to start with the really basics and the most simplest thing to learn first if you're going to be going to the store and shopping for your medicine. When you get a certification in Maryland, you're not necessarily going to get counseled on exactly what type of cannabis to go purchase for your specific ailments. And the reason this is, just a little bit of insight, is all doctors are not required to obtain cannabis training specifically in order to certify patients for cannabis use. Now, this is, in communications right now with organizations and nonprofits such as Americans for Safe Access. And there are people working on this and being able to educate health professionals, or at least start the conversation. However, there are a lot of health professionals and providers that do educate themselves. And in fact, we have a holistic nurse practitioner that is in the office who has she's a nurse practitioner, and she has received her master's from the University of Maryland Cannabis Pharmacy Program. So she is my mentor at this point, and I have been learning from her this year. And so a couple of the things I will be speaking of today, I definitely did receive from her. So give her that credit, and I will put her link, the link again to contact these providers below. So the first thing is, what are the main things you're going to look for when you go to the dispensary? So first of all, there's always been known that there is a difference in cannabis, and that the differences is going to be mainly sativa or indica. You've probably heard these terms. There's another set of differences that we can talk about, and we will briefly, and that is if it is CBD or THC. And now these two topics are legitimate and valid to discuss, because these are terms that have been used over and over and over again in the industry, in the legacy market, in the current medical market. It doesn't matter. These are terms used across the board. So I'm going to give just a little bit of explanation and understanding, and that way you can communicate better when you go to the dispensary. So today, with today's cannabis, 2023, and I'm specifically talking about the medical cannabis in Maryland, there's not always just a strict difference between sativa or indica. A lot of what we are finding with the genetics in Maryland are going to be more of a hybrid. They're going to be more of an in-between kind of genetics, because that is what we're really looking for, right? We're looking for something that's not necessarily going to take us up to the moon, but not necessarily going to put us in the couch all day. When we're looking at medicine, we want people functioning, right? So you're not always going to go in, and you're not always going to get a good response if you say, okay, I'm looking for a sativa. The people at the dispensary might be like, well, our medicine isn't really marketed this way anymore because it is medicine. And so there are ways, a little bit more details to know and ask for when you go to the dispensary that can help you. So in general, yes, it could be where you're looking for a sativa-ish. And what you would think of and what you would speak of then would be what you're looking for as a result. And then they're going to know which strain, which particular name of cannabis would be the best, usually in that situation where we have a person that is looking for, and I'm going to give you an example. Say you're looking for alertness. Say you want uplifting. Maybe you struggle with low mood or depression. You're looking for some euphoria, maybe creativity, but definitely increased energy, not decreased energy. So there are specific things that professionals can look for to know if a strain is probably going to be uplifting. That will go into the THC percentage. You would probably want a lower THC percentage. Again, if you're looking for a daytime alertness, upliftment, creative energy, you're probably going to look for something that's lower THC. And then you're going to go to the terpenes, and you're probably going to look for specific terpenes such as limonene, pinene, possibly. And those are going to be uplifting, more energetic. Not all the time for everyone, but mostly, usually, those are the responses that we hear across the board for these types of details. Okay, so then we have the other side, indica. So, when you're going in, you're really, again, thinking about what you need personally in your medicine, in your cannabis. So say you're looking for deep relaxation. Maybe you want to help sleep, some help getting some sleep, going to sleep. Maybe you have a lot of pain and you simply cannot fall asleep at night because you just feel your pain. Those are some ideas that is going to help you discuss with the people at the medical dispensary what exactly you're looking for. You would let them know, I'm looking for something more relaxing. I've heard it's called an indica. I understand most flower you have today are hybrids. So really, I want something that goes more towards that side of relaxing, nighttime, evening, not going to maybe be very functioning with these strains. Okay. And then they're going to have a lot of in the middle of the road hybrids where, it may or may not make you sleepy, may or may not stimulate your appetite. That's another thing that medical cannabis is highly used for when people struggle with appetite stimulation. Okay, so let's get into now. We're going to just go over 4 different cannabinoids. Again, I really want to keep it simple in this video. This is for beginners starting out on your medical cannabis journey in Maryland specifically. This is kind of a general topic though. So if you're in another state where medical cannabis is legal, this could definitely, you could use this. So the first cannabinoid we're going to talk about is the first one that the plant produces, and it is called CBG, also cannabigerol. And this is a non-psychoactive cannabinoid that is actually produced, that is the first cannabinoid produced in the plant. It is also known as the mother cannabinoid. Research has found that this specific cannabinoid is neuroinflammatory, focuses on anti-inflammation, basically, and slowing the disease progression. Slowing progression of diseases that do progress, typically. It can promote cancer care symptoms, Huntington's, help with Huntington's, promotes nausea relief, glaucoma relief, vomiting relief, IBS relief, and bladder issues and incontinence. Again, CBG is not going to get you, quote, high. You're not going to feel psychoactivity. But it is going to be highly anti-inflammatory, highly therapeutic. And then we go from there to the other 3 cannabinoids that you probably heard more about. And those are CBD, THC, and CBN. So CBD is cannabidiol. It's also non-psychoactive. I like to start with the non-psychoactive, gentlest cannabinoids, when recommending products to people. Again, I don't work directly with products and sales of products. I have just learned about them all. I've worked in the industry for years and have learned about them and the different cannabinoids that are in them. So you will find products that are high in CBD specifically, and what those are going to be for, there's a whole list: Parkinson's, Alzheimer's, pain management, and it's an anticonvulsant, anxiety, spasticity, PTSD, neuropathy, arthritis, IBS, psoriasis, multiple sclerosis, nausea, vomiting, Crohn's disease, migraines, fibromyalgia, cancer care symptoms. It is an antidepressant, anticonvulsant, and a great pain management resource. Again, it won't give you the high sensation, but it will give you the pain relief, the antidepressant, anti-inflammatory effects. So if you know someone that's looking for that particular cannabinoid, or if you yourself need something for relief, but not psychoactivity, go with that. And then we're going to go to THC. THC stands for tetrahydrocannabinol. It is a psychoactive cannabinoid in cannabis, and it does help with a whole list of symptoms, again, in different issues that people are struggling with, like pain, neuropathy, Parkinson's, dementia, depression, cancer care, appetite stimulants, glaucoma, fibromyalgia, Crohn's, Tourette's, psoriasis, pain, arthritis, spasticity, Alzheimer's, anxiety, insomnia, and nausea, and migraines again. And then the fourth one is going to be CBN, and that is cannabinol. Cannabinol. And it is non-psychoactive, but it is sedative. So that's the reason I left that one for last. That's often the one people use at night, at the end of the day, to go to sleep. It can be very sedating, especially when combined with THC. So you will see products marketed for nighttime with CBD with THC and CBN. So, and again, with all of these, the most important thing and instruction is how to use your cannabis, right? So there's just three basic answers to that I have here from Nurse Renee. And it is: one, when storing cannabis, use a container to prevent accidental, potential dangerous ingestions by very young children and animals. We don't necessarily know what the response and reactions would be of animals and children with high doses. There have been some studies that show it could potentially be impairing, however, not necessarily toxic. So we're not talking about death happening, but we are talking about situations where somebody might need to take someone to the ER, which is definitely not a good, fun experience overall. So storing cannabis, just store it away from anybody that basically isn't the patient, is the goal. 2, discuss cannabis use with healthcare providers. With your provider. Review your current medication list and possible drug interactions, because it can happen. There are drugs that interact with the same pathways that cannabis does. And so it's important to be open and honest with our healthcare professionals. If you need a healthcare professional that is understanding and considerate of your medical cannabis use or recreational cannabis use, those links will be below, again, to Gateway Healthcare. Number 3, when beginning cannabis use, start with only a low dose of THC, not more than 5 milligrams. Too much THC, especially when swallowed, is first metabolized by the liver, and it does make it stronger than when smoked. It's also, THC may initiate anxiety or panic if not knowing what to expect. This will pass, but may discourage a person from future therapeutic use. With THC, start low and go slow are the instructions from our nurse. So thank you, Nurse Renee, for helping compile this information. And I really appreciate all the help that you offer at Gateway Healthcare and Seraphim Holistics. I love you, and I love everybody listening, and I'll see you on the next video. Bye-bye.